Male urethra is a tube within the body that is responsible for transporting fluids from our internal environment out to the external environment. It begins within the urinary bladder at a point known as the internal urethral orifice, and it is going to terminate at the external urethral orifice. The male urethra differs from the female urethra in a couple of ways. First, it is much longer in the male as it must travel along the length of the penis. Additionally, we can then subdivide it into 4 different portions. Due to its increased length and the distance that is going to be between the external urethral orifice and the opening of the anal canal, and the lack of the vaginal canal, males tend to be less prone to urinary tract infections or UTIs than females. Additionally, in the male, the urethra not only transports urine from the internal to external environments, but it also transports sperm that is going to be coming up with the ejaculatory fluid that then needs to exit the body during intercourse. So let's now take a closer look at the subdivisions of the male urethra, beginning proximally at the first portion, the preprostatic urethra. The preprostatic urethra is essentially enclosed within the walls of the urinary bladder, and it is located superior to the prostate, or before it, as its name would imply. The second portion is the prostatic urethra, so named as it traverses the prostate gland. Now within the prostate, the junction of the 2 sources of fluids occurs in the male. We see the path of urine that would descend from the urinary bladder, but we can also see the path for seminal fluid, or semen, its course through the prostate as well, in a duct known as the ejaculatory duct. The ejaculatory duct is going to take the combination of the production from the seminal vesicles, or semen, with that from the testicles that came down through the vas or ductus deferens, predominantly sperm. So now this fluid is going to then enter the prostatic urethra. We need to now be able to restrict the flow of one of these fluids while allowing for the flow of the other, and the point of control is between the bladder and the orifice. This is controlled by a small circular muscle known as the internal urethral sphincter, which, when it contracts, is going to not only stop the flow of urine out of the bladder, but it will also prevent sperm from ascending up into the bladder rather than exiting the urethra inferiorly. As we continue along the path of the urethra, the third portion is the membranous urethra, so named due to its location at the level of the perineal membrane, a supportive structure supporting and separating the pelvis from the perineum. The membranous urethra is going to be in close proximity to the external urethral sphincter, a second circular or sphincteric muscle found in the male. Females, by comparison, only have 1 urethral sphincter, while the male will have a sphincter both at the superior and inferior aspects of the prostate. Near the location of the membranous urethra, we're also going to have the bulbourethral gland, which is going to be responsible for producing the pre-ejaculate fluid, which is going to then descend and enter or exit by the 4th portion of the urethra, the penile urethra. Now, the pre-ejaculate fluid from the bulbourethral gland is going to help lubricate the internal aspect of the urethra during an erection to avoid any tearing or stretching due to that lengthening process. As we can see, the penile urethra, the 4th portion, is by far the longest portion of the urethra, and prior to terminating, it is going to widen at an area known as the navicular fossa within the glands of the penis, prior to terminating and exiting at the external urethral orifice.